Hi everyone, my name is Lauren. I'm an ICU nurse and I enjoy helping people memorize physiology and pharmacology. I especially help by giving people mnemonics and memory tricks so that they can remember this information on an exam or in practice. So this video is going to be about heart sounds, both normal heart sounds and pathological heart sounds, and how to remember which ones are which and where to listen for them. So first I want to talk about S1 and S2. And that's the lub-dub everyone talks about. Lub-dub, lub-dub, lub-dub. So you can memorize this two different ways. The way I memorized it originally was to draw blood flow through the heart and look at what's happening in systole, what's happening in diastole, and what valves are going to be open. Now remember, heart sounds come from valves closing, or when blood isn't flowing correctly, right? It's turbulent blood flow, or blood is sort of squishing through either a stenotic valve or regurging through a valve that's not working. Right, so normal blood flow should be silent. You shouldn't be able to hear normal blood flow through normal valves. But if valves close, you can hear that. And if you have an artificial valve, you can hear that. And then if you have turbulent blood flow, either you're fluid overloaded and blood is hitting itself, like an ocean wave would make noise, or blood is squishing through where it's not supposed to be through a stenotic valve, or regurgitating through a incompetent valve, that will make noise. So think about diastole. You have your tricuspid valve and your mitral valve are open and blood is flowing through that. So remember, tricuspid is on the right, try to get it right, and mitral is on the left. So that's diastole, but we care more about which valves are closed because those are the valves that are going to make noise when they close. So during diastole, your pulmonary and tricuspid valves are closed. Or sorry, pulmonary and aortic are closed. During systole, it's going to be the opposite. Your pulmonary and your aortic valves are going to be open. The blood is going to be flowing out to your lungs and to the rest of your body. And your tricuspid and mitral valves are going to be closed. So it's important to know and picture which valves are open and which ones are closed. For me, it was hard to memorize at first which ones are closing at the time of diastole and systole. So what helped me remember this is think about it in this timeline. If you know that systole takes 1/3 of the heart contraction cycle and diastole takes 2/3 of it, and you know that you have lub-dub, pause, lub-dub, 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 right? There's a pause, so that pause is going to be that diastole. So we have lub here, which is our S1, and then we have dub here, which is S2, and then the rest of this time is just diastole. And why is this long time not systole? Well, because we know systole is 1/3 of the cycle, so this 1/3 over here is systole. And the 2/3 is diastole. So think about it, at the end of diastole, we have a sound. At the beginning of diastole and asystole, we have a sound. So think about what's happening during diastole. Well, our ventricles are filling. And so that means our tricuspid is open and our mitral is open. So our pulmonic and aortic valves are closed. So that's the sound we're hearing at the beginning of diastole. So this dub S2 is your pulmonic and aortic valves closing. And then during systole, we have the opposite. We have your tricuspid and mitral are closed. And that's the S1 sound, is your tricuspid and mitral valves closing. and we have your pulmonic and aortic are open. So think through that, decide what memory trick helps you remember that the best. To remember that S1 is your tricuspid and mitral valves closing, and S2 is your DUB, is your pulmonic and aortic valves closing. Your S2 signifies the end of systole and the beginning of diastole. Your S1 signifies the end of diastole, the beginning of systole. So let's talk now about S3 and S4. So S1 and S2 are normal sounds. S3 and S4 are pathological abnormal sounds. And while they're considered abnormal, there are circumstances in which an S3 might be normal for a particular person, and we'll talk about that. But my tricks for remembering these are S3 is present when you have fluid overload. Specifically fluid overload in your ventricle, right? It's the sound of this turbulent blood flow when blood is rushing into your ventricle and it's hitting blood that's already there because you're fluid overloaded. You didn't inject all of your blood out, and so blood is hitting blood that was already there, and you have this turbulent noise. So I think S3, think about the 3, is sort of fluid in the way you draw it, or you can think about sort of waves of water look like little 3s. Fluid overload. S3 is also can be a normal sound if you have turbulent blood flow that's just, you have blood that's flowing very quickly, which can happen with kids or pregnant women. They just have, pregnant women have like a third more blood flowing through their system than normal women. And kids just have a higher heart rate, higher blood is flowing through. So it can be normal, but S3, think about 3 for fluid overload. S4 is when you have stiff ventricles. Stiff or non-compliant. So you have this blood that's hitting this non-compliant ventricle, and so that's turbulent, it's making noise. So think about the 4, S4, this is a very stiff number, right? The 4 has straight, stiff, non-compliant lines versus 3 is fluid overload. 4 is stiff, non-compliant ventricles. So those are heart sounds, S1, 2, 3, and 4. Watch my next video where we'll talk about where to listen on the body for these sounds. We'll talk about what part of the stethoscope to use for high-pitched sounds, low-pitched sounds, things like that. Comment below, let me know if you have any questions, if you found this helpful. And thank you to allnurses.com for help sharing my videos.